Canadians across the country are being told to go into self-isolation to try and stop the spread of coronavirus. But at a time where Canadians are living alone more than ever, experts are raising the alarm on other health issues that can come out of self-isolation: loneliness.
What we're seeing is people are asking for more medications in regards to anxiety and depression. There's a lot of uncertainty in terms of, what's going to be happening with their job situation, in terms of even if they're going to be able to get their medications. And so we're finding that a lot of people with this new increased self-isolation, that they're worsening their symptoms of anxiety and depression.
Dr. Adil Khan says he has been receiving 30% more calls since the COVID-19 outbreak started.
Not only people who have pre-existing mental health conditions are finding their symptoms are worsening, but people who previously never had any mental health conditions are now having issues as well because they don't have access to the regular outpatient services. They can't see their regular psychologist. They can't see their regular counselor. They can't see their regular social worker. And so they're relying on us to help them. And, unfortunately, the best thing we can do often is prescribe the medication to help cope with everything. Loneliness in itself is a risk factor for many medical conditions. It's been increased risk of, dying earlier, increased risk of, heart disease, cancer, a lot of other conditions.
Recent research shows that social isolation, loneliness, and living alone can increase the possibility of death by 30%. The number of Canadians living alone has more than doubled in the past 35 years, according to StatsCan. Nearly 4 million Canadians lived alone in 2016. Dr. Khan says seniors are most at risk when it comes to suffering from loneliness. The policy director of National Initiative for the Care of the Elderly, Laura Tamblin-Watt, says it's an especially tough time for seniors right now because of self-isolation.
In long-term care, and in some cases even retirement homes, people are on a really severe lockdown, and that may include restrictions not allowing people to either come in or out of the long-term care facility. So it can be very difficult.
There are things family members, neighbors, and friends can do to help.
If you can go by their window and give a wave, it gives a huge lift to the spirits. We're asking people if they can exercise together, even if they can't see each other, maybe just be on the phone, or you're having exercise or book clubs together.
Tamblin-Watts has a number of suggestions to help somebody who is feeling lonely. Leave FaceTime or Skype on so a loved one feels like they're a part of your household. Schedule e-visits, watch movies and TV shows together simultaneously, and even have a virtual tea together. Maleeha Sheikh, City News, reporting from my home in self-isolation.